You know, it's been a busy week when it comes to vaccines in the U.S. The Pfizer COVID-19 vaccine for children between ages 12 to 15 was just approved, and appointments will be opening up today.
Yeah, this comes as new numbers show there are more cases of coronavirus in people between the ages of 12 and 17 than the over 65 group. In fact, the CDC estimates that more than 22 million children between the ages of 5 and 17 have been infected with coronavirus since the start of the pandemic.
The CDC voted to recommend the two-dose Pfizer vaccine be used in children ages 12 to 15 yesterday. The virtual meeting was held just 2 days after the FDA authorized it to be used in that age group, after data showed it was 100% effective. During the meeting, CDC officials added the COVID-19 vaccine can be administered on the same day as other vaccines.
In Arizona, appointments are open at state-run sites and some pharmacies. There are also walk-in availabilities as well. So if you plan to get your kids vaccinated, just know a parent must be present with the child and a consent form must be signed in person. Identification is not required for the child. We know many of you have a lot of questions when it comes to kids getting the COVID-19 vaccine.
So we're going straight to the source. We brought in Dr. Gary Kirkelis from Phoenix Children's Hospital to answer some of them live for you this morning. Good morning, doctor. Thanks for being with us.
Thanks for having me.
All right, so let's get right to it. Our first viewer question this morning comes from Elia on Facebook. She asks, is it safe for kids with autoimmune diseases to get the vaccine?
Sure, good question. So it really depends on if the child is on an immunosuppressive medication. If that's the case, it would be a good idea to speak with their pediatrician. The reason being is when you're on an immunosuppressive medication, you're basically blunting the immune response. And the whole purpose of getting the vaccine is to create an immune response. We want those antibodies to protect our children from getting COVID. So if a child has an autoimmune disease and is on immune suppressive medication, again, it would be a good idea to speak with their pediatrician before proceeding. But as far as I'm aware, there are not many medical conditions that would preclude a parent from getting or a child from getting the vaccine.
Our second question this morning is from Rachel, who asks, what are the long-term effects and how will this affect their future? Will they be forced to stay home if they can't get one for medical reasons, like those who cannot wear a mask have been asked to?
So another good question. I think most parents are as myself, I'm a parent. I have 3 young children, and I get this question quite a bit. They're concerned about the long-term effects. I think parents have that concern whenever there's a new vaccine or new illness. And for myself, I always tell parents that the potential short-term side effects of pain at the injection site, some fatigue, those are much better than any of the potential effects of getting COVID. Let's not forget that we've had about 14,000 children hospitalized for COVID. We've had about 300 deaths in the United States. So for myself, it seems to be a much safer option to get our children vaccinated. As far as the second part of the question, I think it remains to be seen whether it will be required for schools. That's just speculation. I know we want our children to be immunized. I basically spend all day immunizing children against things like chicken pox and polio, all things that we don't have to deal with now that we have vaccines. So I guess that we'll see what happens in the future.
I'm going to ask a quick follow-up to that last question about the long-term effects. And a lot of folks will have that question saying, oh, it's only been around for a few months, so how could we even know the long-term effects? What would your response to that be?
Well, in actuality, this pandemic's been going on for over a year, right? And so the adults that had got this vaccine have had it over a year ago, and they've been continuing to monitoring it. We have the VAERS system, the Vaccine Adverse Effect Reporting System. There has been no association with any medical conditions to be associated specifically with the vaccine. So I think we have a good year's worth of data to show that there has been no associated effects. Though we do have plenty of data about long COVID and some of the long-term effects of COVID. So I think it's still in the best interest of parents to strongly consider vaccinating their children.
Mm-hmm.
All right, so we do have one more question. This one, I believe, is from Poyette, and she asks if you have one brand and annual boosters are required, is it the same brand for life? What happens if you do different ones? So I guess if you got Pfizer now, could you then get Moderna later or whatever other ones might be out there?
Sure, good question. Typically with other vaccines, so with the other childhood vaccines, we do the same brand because there's usually a schedule that goes along with it. So for example, Pfizer is a 21-day in between the 2 doses, Moderna is 28-day. So it would be wise to continue to using the same brand. when you start with one. And it'll be remain to be seen if we need annual boosters. Probably likely so, considering the variants that we're seeing. And just like kind of like with flu, every year we see a different flu, and so therefore we need a new booster flu vaccine.
Yeah, that makes sense. Dr. Kirkles, thank you so much for your time this morning. We really appreciate you joining us and answering some of these very important questions that parents and families have right now.
Of course, it's my pleasure. It's here at Phoenix Children's, that's what we do, is answer parents' questions and hopefully help them to make an informed decision.
Thank you so much. And in full transparency, my husband is an employee at PCH. Thank you again.